Bismillahirrahmanirrahim. Quote of the day is compromise for your dream, but never compromise on your dream. Assalamu alaikum everyone. I'm Dr. Shajeea Javed, PGR Community Medicine, and I'm going to present the topic of universal health coverage and its financing under supervision of Professor Dr. Saira Afzal. Learning outlines. In today's session, we will cover introduction to universal health coverage, importance of universal health coverage for the health system, universal health coverage financing and key models, challenges which are faced for universal health coverage, key facts and the recent updates, global progress on universal health coverage, primary healthcare as the building block of universal health coverage and health financing in Pakistan, and at the end there will be MCQs. In today's session, at the end, learning outcome. At the end of this presentation, participants will be able to understand the concept and significance of universal health coverage and health financing, explore different health financing models and their effectiveness, discuss barriers and challenges in achieving universal health coverage, and analyze the current state of the health financing in Pakistan and its implication for universal health coverage. So, what is universal health coverage? Universal health coverage is a healthcare system that ensures all the individuals and community can access essential health service without facing the financial hardship. It aims to provide equitable, affordable, and quality healthcare covering a wide range of services such as preventive care, which include vaccines or screenings, promotive care like health education, curative care, for example, treatment of diseases, rehabilitative care like physical therapy, or palliative care, pain relief for chronic conditions. Universal health coverage road and WHO. Achieving universal health coverage is one of the targets the nation of the world set when they adopt the Sustainable Developmental Goals in 2015. Countries reaffirmed this commitment at United Nations General Assembly high-level meeting on universal health coverage in 2019. The key components of universal health coverage, service coverage. The quality of the healthcare service should be good enough to improve the health of those who are receiving those services, and it should be effective, safe, and timely to improve the health outcome. Financial protection. Protection from the catastrophic health expenditures. People should be protected against the financial risk, ensuring that the cost of using services doesn't put the people at the risk of financial harm. There should be mechanism for reducing the out-of-pocket payment methods. Equity of access. Reaching vulnerable population, reducing disparities in the healthcare access. Everyone who needs these services should get them instead of those only who can pay. Achieving universal health coverage along the coverage queue. The universal health coverage concept encompasses three dimensions: the coverage, which is the bed, the population who is covered, then there are the number and the type of the services which are covered in the depth, and the proportion of the total health services cost that are publicly funded and not subject to the cost sharing, which is also called as the financial risk. And all this is best reflected in the universal health care coverage queue. The importance of universal health care coverage, health impact. It improves the population health outcome, reducing the mortality and morbidity. Economic impact. It protects people against the poverty due to the medical cost. It enhances the productivity and economic growth. Social impact. It reduces inequalities in the health, enhances social cohesion and the trust in the government institutions. Universal healthcare coverage financing key components. Health financing refers to the strategies which are used to generate, allocate, and manage funds for the health service. It is a critical component of a well-functioning healthcare system, and it is very essential for achieving the universal healthcare coverage. The components are revenue collection. This involves gathering financial resources to fund the healthcare services. Sources of funding can be taxes, social health insurance, private health insurance, out-of-pocket payment methods, or the donor funding. Revenue generation in Pakistan. Government healthcare spending is very low in Pakistan. It is around 1 to 2% of the total GDP. We mainly rely on the external aid and donors for the funding. Purchasing healthcare service. This refers how the funds are used to purchase the healthcare services. It allocates the resources to the provider to deliver the health service efficiently. Purchasing of the service in Pakistan. Public health facilities are often underfunded and overstretched in Pakistan. Private sector accounts for the major portion of the healthcare services, but affordability remains a barrier. Risk pooling. Spreading the financial risk across a large population, risk pooling protects individuals from the catastrophic healthcare expenses which can push them into poverty. It ensures that the high-cost healthcare needs are distributed across the entire population, promoting fairness and accessibility to the healthcare service. Risk pooling is a fundamental principle behind the health insurance schemes. Risk pooling in Pakistan. Pakistan has limited risk pooling. The Sehat Sahulat program covers a very small fraction of the population, primarily the low-income group. Health financing model. There are different models, for example, the tax-based system. In this model, the healthcare is primarily funded by the general taxation. The United Nations NHS is a prominent example where the health care services are largely free at the point of the use and are funded through taxes. Social health insurance, the system where the employers and the employers contribute to the mandatory health insurance scheme. They fund pool resources to ensure the coverage of the entire population, maintaining equity and sustainability, for example, in Germany and Japan. Private health insurance system, voluntary insurance schemes where the private health insurance play a significant role. However, it is criticized for leaving many people uninsured or underinsured, which can lead towards a high out-of-pocket expenses. For example, the system of USA. Community-based financing, a model which is used in some low-middle income countries with collective funds from the community. Sustainability, scalability, and the limited coverage are the key challenges of this community-based financing model, for example, in different sub-Saharan countries. Global example of universal healthcare financing, high income countries, UK. The NHS in the UK is funded through general taxation, Germany. Social health insurance model, middle income countries in Thailand, we have universal coverage scheme, which is a hybrid system with the tax-based and contributing financing. Brazil has unified health system funded through the taxation. Low income countries like the efforts in Rwanda and Ghana using a mixture of the government donor support and the insurance scheme. Innovative financing mechanism, to finance the healthcare, there are different innovating mechanisms like sin taxes. Taxes on tobacco, alcohol, and sugary drinks are the source of the healthcare financing. Public-private partnership, collaboration between the government and the private sectors for the healthcare infrastructure and the service provision. Digital health technology, leveraging mobile technologies for the better financial inclusion in the healthcare services. The role of the governance in the universal healthcare financing is very important. The leadership need to be effective, and there's a need of a strong political will and a commitment to finance the universal healthcare coverage. The strengthening of the institution can be done by the transparent and accountable health financing mechanism, and there is a need for the multi-sectorial approach with the collaboration across the different sectors like the health, finance, education, and the social welfare. Challenges in the universal healthcare coverage financing, fragmented system. Some healthcare systems are fragmented, meaning that there are the various independent schemes, public, private, and community-based, that do not coordinate well with one another. This creates inefficiencies, inequities in access, and the duplication of the service, driving up the cost. Aging population. As the population ages, the demand of the healthcare services increase. Countries with a rapidly aging population face higher healthcare costs, especially for the chronic diseases requiring more robust financing mechanisms. Donor dependency, reliance on external funding, particularly in the low middle income countries. Sustainability of financing. Many countries, especially the low and the middle income countries, struggle with the limited financial resources for the healthcare. This underfunding leads to a gap in the coverage and the quality of the care, often relying on out-of-pocket payments from the patient, which can push them into poverty. Political commitment. Ensuring adequate and sustained financing for the universal healthcare coverage requires strong political will. Some governments prioritize other sectors over the health or the lack long-term commitments to the healthcare reforms, resulting in inconsistent funding. Other challenges are unregulated healthcare system, increasing burden of non-communicable disease, lack of the quality, aging population, large healthcare inequity, increasing unmet health needs, failure in service expansion, expansion of the healthcare coverage, rapid privatization of the healthcare services, and the lack of recognizing priority demands. Strategies for sustainable universal healthcare coverage financing, expand the fiscal space for the health, increase government spending on the health through the taxation reform, improve efficiency, reduce the waste in the health system like over-prescription or inefficient procurement, progressive universalism, prioritizing the poorest and the most vulnerable population for the coverage of the health, and global solidarity, role of the international aid and the financial cooperation in the low-middle income countries. Key facts and the recent updates. Universal health coverage key facts. The Universal Healthcare Coverage Index increased from 45 to 68 between 2000 and 2021. However, recent progress in increasing coverage has been slowed as compared to the pre-2015 gap, raising only 3 index points between 2015 and 2021 and showing no change since 2019. The proportion of the population which is not covered by the essential health services decreased by about 15% between 2000 and 2021, with a minimal progress which is made after 2015. This indicates that in 2021, about 4.5 billion people were not fully covered by the essential health services. The COVID-19 pandemic furtherly disrupted the essential health services in countries at the height of the pandemic in 2021. In 2022, 84 of the countries still reported disruptions. To build a better back, WHO recommends to reorient a healthcare system using a primary healthcare approach. About 90% of the essential universal healthcare intervention can be delivered through the primary healthcare approach. Global progress on the universal healthcare coverage. Global initiatives. The WHO and other global organizations like the World Bank are pushing universal healthcare coverage through the programs like Universal Healthcare Coverage 2030 Partnership. Universal healthcare coverage is a key target under United Nations Sustainable Developmental Goals, which calls for achieving UHC by 2030, ensuring that everyone has access to the quality health service without the financial hardships. Progress on the UHC showed that universal health service coverage index improved from 45 in 2000 to 67 in 2019. The global average life expectancy has also increased. The fastest growth is seen in Africa region. Between 2013 and 2020, the number of the healthcare workers globally increased by 29%. Significant progress in expanding the access to the medicine and other essential health products and strengthening regulation was there. WHO's special program for the primary healthcare with the Universal Healthcare Coverage Partnership supports around 120 countries with in-country policy advisor, and 95% of these countries increase their service coverage. Launch of the Universal Healthcare Coverage Global Monitoring Report 2023. The latest WHO and the World Bank 2023 Universal Healthcare Coverage Global Monitoring Report provides crucial insight into the global progress towards the universal healthcare coverage. Unfortunately, it reveals significant challenges. As of 2021, more than half of the global population, like around 4.5 billion people, still lack access to the essential healthcare services. Moreover, about 2 billion people face severe financial hardship due to the out-of-the-pocket health expenses. Catastrophic health spending, where the costs exceed 10% of the household budget, affect around 1 billion people globally. Primary healthcare is the building block of the universal health coverage. WHO recommend to reorient the healthcare system towards a primary healthcare as a foundation for the universal healthcare coverage for health security and a better health, for equity, effectiveness, and efficiency. It is founded on the rights and the social justice. Around 75% projects of the health gain from the Sustainable Developmental Goals could be achieved through the primary healthcare, saving around 60 million lives and increasing the average life expectancy by 3.7 years by the year 2030. It reduces the burden of the communicable and the non-communicable diseases and improves the health through the life course. 90% of the essential universal healthcare coverage intervention can be delivered through the primary healthcare approach. WHO recommends reorienting the USC towards PHC at the center of the efforts to achieve the universal healthcare coverage and the health-related sustainable developmental goals. For this, the Astana Declaration in 2018 recognized that the primary healthcare provides a platform for accessible, affordable, equitable, integrated, quality primary care and a public health services for all. It supports a multi-sectoral action for the health and engages people and communities in their own health and the well-being. The United Nations General Assembly Political Declaration on the USC 2019 reaffirms that the PSC is the cornerstone for the sustainable health system. All countries within the Eastern Mediterranean region signed the Salalah Declaration and USC 2030 Global Compact in September 2018, committing to make the collective action towards universal health coverage through building equitable, resilient, and the sustainable health systems. Primary healthcare theory of the change is based upon the integrated health service with an emphasis on the primary care and essential public health function, empowering people and community with a multi-sector policy and action having operational and a strategic level, and it will result into improved access, utilization and quality, improved participation, health literacy and the care seeking, and improved determinants of the health. Universal healthcare coverage, financing and the role of the World Bank. World Bank state that in many developing countries, financing for their health is insufficient. Like by 2030, the gap in financing universal healthcare coverage in about 54 poorest countries will be around 176 billions per year. It will be inefficient, like 20 to 40% of the health spending is wasted, and it is inequitable. People in the developing countries spend around $500 billion each year on out-of-pocket health expenses. This pushes around 100 million people globally into the extreme poverty. The World Bank aims to support the countries in delivering quality, affordable healthcare service to around 1.5 billion people by the year 2030. For this purpose, the World Bank is leveraging two partnerships which is hosted by the bank: the Global Financing Facility for the Women, Children and Adolescents and the Pandemic Fund. It is to crowd in more financing to end the preventable deaths for the women, children and adolescents and to ensure that the world is betterly prepared for the next pandemic. The World Bank will also collaborate closely with other key partners in the global health such as the Global Fund, Gavi, the Vaccine Alliance, and the World Health Organization to streamline the funding for the global health, avoiding duplication and providing better targeted response to meet the challenges which are faced by billions of people in the need. Universal health coverage in Pakistan. Pakistan is the fifth most populous country in the world with a population of around 212 million in 2018. Most health services in Pakistan are concentrated in tertiary and secondary hospitals. Pakistan's universal healthcare coverage index is around 45 out of 100. In its national health plan 2016 to 2025, Pakistan pledged to increase the federal and the provincial allocation to the health to 3% of the GDP and identify better coverage and more functional primary healthcare services as a strategic priority for the federal and the provincial governments to achieve the universal healthcare coverage. Primary healthcare strengthening and the health financing reforms is a priority for the federal and the provincial governments of Pakistan. They are going to strengthen the district governance, which is crucial for effective coordination and leadership for the primary healthcare coverage at the district level. Increasing and diversification of the universal healthcare coverage financing, prioritizing the community and the primary level, strengthening the human resources for the health, taking a province-driven approach and prioritizing the PHC worker, including the lady health workers, ensuring the supply of the essential commodities, ensuring equitable and resilient access to the healthcare services, including thorough innovative strategies for hard-to-reach population and behavior change interventions, and improving the healthcare quality in both the public and the private sector by implementing accountability and performance framework for both the public and the private sector. The Health Commission. Key aspects of universal health coverage in Pakistan. Government initiatives. Sehat Sahulat program is the Pakistan's flagship social health protection initiative, providing health insurance to the low-income family. It is a significant step towards universal healthcare coverage, offering coverage for hospitalization and surgical treatment for the millions of the families. Sehat Sahulat program is a leap into the universal health coverage in Pakistan. In line with the WHO recommendation, the USC was first introduced in Pakistan in KPK province under the name of the Sehat Sahulat program, which literally means Health Facility Program in 2015. After its success in the initial phase, Government of Punjab also allocated Rs 65 billion to implement SSP in December 2020 with the plans to provide a Sehat Insaf card to the families in all the 36 districts across the Punjab. On December 2020, the Prime Minister of Pakistan announced the extension of the SSP program to the people of Azad Jammu Kashmir in more than 350 eligible hospitals in Pakistan, covering a million of the families which were expected to benefit from this initiative. Currently, the HSP only provides coverage to the family which are living below the line of poverty, like they are earning less than $200 per day, equivalent to 32.5 poverty means test score from the National Socio-Economic Registry of Pakistan. Health financing in Pakistan, mixed health system. Pakistan has a mixed health financing system that combines public and the private sector contribution. The government share in health financing remains very low. It's around 1.2% of the GDP, meaning much of the healthcare costs are out of pocket, contributing to the financial burdens on the household. Out of pocket expenditure, about 60% of the healthcare spending in Pakistan come from out of pocket, leading many families to experience financial difficulties, pushing them into poverty. This makes financial protection a major component of the universal healthcare coverage. Donor contribution. International donors like World Bank, WHO, and other organizations provide significant financial support, particularly for the primary healthcare and immunization program, helping filling the gaps left by the public spending. The role of private sector. The private sector play a very dominant role in the healthcare delivery, providing around 70% of the outpatient services. However, there is a little regulation or the oversight leading to the variability in quality and the cost. To move towards a universal healthcare coverage, the government needs to integrate and regulate the private providers effectively. Challenges in achieving universal healthcare coverage in Pakistan, low public health expenditure. Government health expenditure remains far below the recommended global benchmark, which is 5% of the GDP. This restricts the capacity to expand the public health service, improve infrastructure, and increase health personnel, which are critical for universal healthcare coverage. Inequitable access, geographic and socioeconomic disparities exist in the healthcare access, with the rural areas and the low-income household facing the greatest barrier to receive quality care. Service delivery gap. Pakistan healthcare system suffers from inefficiency, inadequate infrastructure, and the lack of the essential medicine in the public health facilities, further complicating the goal of the UHC. Conclusion. Pakistan has made progress towards USC, particularly through the insurance program like Sehat Sahulat. However, challenges such as the low financing health, high out-of-pocket spending, and inequities in the access continue to hinder the comprehensive USC. Significant improvement in the public health, better integration of the private sector services, and increased policy commitments are necessary to ensure the sustainable progress. Universal health coverage in Pakistan is a health system geared up to take on the challenge. Pakistan must pursue universal healthcare coverage attainment as a driving force for achieving the Sustainable Developmental Goal by 2030. It is important to note that the health system of Pakistan must be transformed to strengthen all the three dimensions of the universal healthcare coverage by maximizing the population which are covered, increasing the range of the service which are offered, and reducing the cost share. In conclusion, COVID-19 pandemic had relieved some major gaps in the healthcare system capacity to deliver equitable healthcare, which is the cornerstone to achieve the universal healthcare agenda. The priority setting process will need to be aligned with the SDG to ensure that the agenda for the action towards 2030 is comprehensively addressed and successfully accomplished, preferably before but hopefully not beyond the target dates. Although the Pakistan political leadership is geared up to achieve the ambitious UHC agenda, there are three prerequisites that need to be filled. Budgetary allocation for the health as a percentage of the GDP must be increased. Health system readiness, especially the public sector, ought to improve in terms of the human resources and the availability of essential services. Safety nets for the health must continue, regardless of the change in the political regimes. Decrease the reliance on the donor funding and accountability to be ensured across the board of the service provider, managers, administrators, and policymakers in the health system. Providing affordable healthcare to the entire population is the key national agenda of the government of Pakistan. It is obvious and evident from the other country example that in the region like Thailand and the Philippines, that the success of the universal healthcare coverage will induce a significant and lasting impact on the population health. It is to be noted that the social health protection and UHC contribute not only on the health but also to the poverty reduction and to the advancement of the many sustainable developmental goals that are linked to the health. Now, time for the MCQs. Number one, a low-income country is working towards achieving universal healthcare coverage. Despite its efforts, the government is facing significant financial challenges. The country has a large informal economy where many citizens do not contribute towards the tax revenue. But it's a primary challenge this low-income middle country is facing in financing its universal health coverage initiative. Number eight, high cost of implementing digital health system. Number B, lack of the healthcare providers in the urban areas. C, ability to generate sufficient revenues from the taxes and contribution. D, overdependence on the public-private partnership for the healthcare funding. And E, overfunded public health facilities.
C, inability to generate.
C.
C is the right answer. Pakistan has limited risk pooling in the health financing. What purpose does the risk pooling has in health financing? A, reduce the cost of the healthcare service. B, prevent healthcare providers from monopolizing the system. C, protect individual from the catastrophic healthcare expenses. D, to allow patients to select services which are based upon their income level. And E, to increase the government spending on health.
C.
E.
C is the right answer. In a country, the government provides healthcare service funded primarily through the general taxation. This means that the healthcare is funded by the income and the sale tax collected from the population, and all the citizens have access to the healthcare services regardless of their ability to pay at the point of the service. This model is likely to be which of the following: A, social health insurance; B, private health insurance; C, community-based financing; D, out-of-the-pocket payments; and E, tax-based system.
E.
E is the right answer. In a country, the government allocates a large portion of its budget to infrastructure projects, leaving healthcare underfunded. As a result, many hospitals are facing shortage of essential medicines and equipment. What primary barrier to USC coverage this scenario illustrate? A, economic instability; B, competing government priorities; C, lack of the public awareness; D, high rates of the disease prevalence; and E, relying on the donors.
C.
B is the correct answer, competing government priorities. In a low-income country, the government is trying to finance its universal health coverage program, but budget constraint and inefficiency in the healthcare delivery are limiting its ability to provide widespread coverage. The government is considering implementing a sin tax to generate additional revenue. What type of the tax is referred to as sin tax in the contents of health financing? A, corporate tax; B, value-added taxes; C, taxes on the luxury good; D, taxes on tobacco, alcohol, and sugary drinks; and E, income tax.
D.
D is the
D.
correct answer. Number six, a country has pledged to meet the SDG by 2030, focusing on improving the healthcare access. As a part of these efforts, the government is prioritizing USC, ensuring that its citizens have access to the essential health services without suffering from the financial hardship. But it's a primary goal of the universal health coverage as aligned with the SDG. A, to offer free healthcare for all the citizens. B, to ensure equitable access to the essential healthcare services. C, to eliminate private healthcare. D, to reduce government expenditure on the health. And E, to centralize the healthcare under one authority.
B.
E.
B is the correct answer. A recent study in Pakistan highlights the disparities in the healthcare access between urban and the rural population. While urban centers have better healthcare facilities, rural areas struggle with inadequate services. How does this urban-rural disparity impact the goal of the UHC? A. It promotes a competitive healthcare market. B. It creates a barrier to equitable access to the healthcare services in the rural area. C. It enhances the quality of urban healthcare facility. D. It leads to increased healthcare funding in the rural area. E. It increases the tax on the rural area.
B.
B.
D is the correct answer. Private health insurance is a popular method of financing established in the countries like USA. However, it has the following major drawback for which it is criticized. A. It provides universal access to the healthcare. B. It is heavily funded by the government. C. It leaves many people uninsured and underinsured. D. It offers free healthcare at a point of the use. And E. It supports the poorest country in population.
C.
C is the correct answer. In Pakistan, healthcare is financed through the multiple payment method with a significant proportion of people paying directly for the medical services through the out-of-pocket expenditure. But is the key challenge that out-of-pocket expenditure results in achieving USC? They cover the only luxury treatment. B. They place a high financial burden on the family. C. They are fully funded by the international donors. D. They are managed by private health insurance company. And E. They are low compared to the global standard.
B.
B is the correct answer. Pakistan is experiencing a demographic shift with an increasing proportion of elderly citizens. What is the main challenge Pakistan faces in achieving universal health coverage with its increasing population? A. Decrease healthcare demand. B. They lower the healthcare cost. C. They require more robust financing for the chronic disease. D. They contribute to the healthcare fragmentation. And E. They reduce the need for the preventive care.
C.
C.
Yes, C is the correct answer. This is the key to the MCQs. The link to our YouTube channel where the video will be uploaded. Thank you.
Thank you very much, Dr. Shajeea. Very nice presentation. The good points are that you have covered a very good content. Your knowledge about the slides and how you have presented, it was very well elaborated, and you have shared it very well. Number second, the quality of your voice and the amount of the knowledge that you have shared, both are good. However, there are certain important things that should be noted. Number first, most of the slides, they were black and white. And in MCQ, especially if you go to your please MCQ number 3, it needs further elaboration. Would you please go to your MCQ number 3?
Yes, ma'am. Yes, ma'am.
Right. Would you please like to tell me why the correct option is C and why not the other ones?
And the correct option is E.
E, right. So why E, not the other ones?
Ma'am, in this scenario, we are basically talking about the general taxation. The government is providing healthcare service funded primarily through the general taxation, but like income tax or the sale tax. So that why the correct answer was E, the tax-based system.
And where you have presented it in the presentation?
Ma'am, in the very first slides, let me show you. Ma'am, this is
Okay, thank you very much. But when you were presenting, I think you have said C, but now you are saying that it is E. Okay, then it's fine. And the most important thing is that in SDGs, as we know that in 2030, we have to show how much SDGs we have covered. And universal health coverage and universal health care is the essential part of SDGs. And in Pakistan, when we talk about SDGs, we always talk about UHC. And UHC, we know that the most important things are about the equitable distribution, cost effectiveness, the participation, and by using appropriate technology, we have to reach at every doorstep. We have to make a maximum community aware of it. As this is the notion, the most of the points are very well covered in your presentation, and I am very hopeful that the UHC would become a very nicely elaborated topic, especially in the minds of my students. So thank you very much, and keep it up.
Thank you, ma'am.